In this section, we will be looking at the business aspect and the ecosystems surrounding the healthcare landscape. How are we connecting research with the community beyond the university walls? What possibilities do we have in Halland specifically? And hopefully you will get a sense of how you can start interacting with the right actors if you have a research idea or business idea. It's my pleasure to welcome our next two speakers up on stage. We have Lillemor Berglund, Executive Director of Health and Social Care, Kungsbacka Municipality, and we have Magnus Clarin, PhD in Physics, and he is also the Dean of the School of Information Technology at Halmstad University. Please.
Thank you. First of all, I want to thank the team behind this conference. You have done a really great job, and I also want to thank the opportunity for letting us present LEAP here today. We will start this presentation a little bit different. We have a video that we want to show you to give it a context. So hold on a minute. So, 10 years ago, the collaboration arena Center for Health Technology Halland was created by Halmstad University, Region Halland, and the 6 municipalities, together with the industry. Since then, the world has changed, and the healthcare. We are now entering a new phase. With Leap for Life, we gather partners to collaborate, drive innovation, and act as the driving force for change within healthcare, regionally, nationally, and internationally. So, what is the challenge? Well, the challenge is we need to rethink. Halland is facing large health challenges, so is Sweden and the rest of the world. Health gaps are increasing, obesity, high blood pressure, and mental illness is becoming more common. Healthcare is subject to antibiotic resistance and pandemics. Since more people live longer because of medical breakthroughs and better welfare, the need for qualified healthcare increases, and the cost will increase substantially. So, the disease panorama is changing. Fatal diseases become chronic, and this will lead to increased costs for the healthcare sector. Large amount of data are prerequisite for fact-based care delivery. Thanks to technical development, large amount of health data are generated daily, both within healthcare and by other actors. It is everything from information about individual persons' treatments and health in directories and journals to information about health and lifestyle being gathered in apps and sensors. Real-world data from the ecosystem of the world can be used for research, but also address important matters like confidentiality, integrity, cybersecurity, and regulatory framework. So, what's the solution? Well, a big part of the solution is information-driven care. It's fact-based, system-wide, and patient user-centered, supported by leading technology. To manage the challenge that healthcare faces, we need to focus on preventative methods. By using AI and machine learning, we can use data and digital solutions to make intelligent decisions and algorithms. At the same time, healthcare needs to implement new ways of working, new technology and new treatments, and it needs to happen now. Similar solutions can be used to increase the quality and efficiency in caretaking by investing in professional development and new welfare technology. Everyday life improves for both care recipients and caregivers. You have seen this picture before. This is the fundamental in information-driven care, the value chain. It doesn't matter how much data you gather if you can turn that into information and new knowledge to create behavioral changes in the organization, and in the end create a better for the patient. So this is extremely fundamental, and it is in this way the advanced technique that we have talked about earlier today comes in. This is also a very simplified image. You have seen it before. It's illustrating the principle of information-driven healthcare system, and this has actually been implemented in Region Halland, as Marcus Lingman previously talked about. So what happens in Halland? Well, we have the right conditions. Together we have the necessary ecosystem of competence integrated. That means healthcare development, business development, and research. An analysis carried out by Dembad Analytics states that health is a strong field in Halland. There are many strong actors and well-developed collaboration between the business sector, academia, and different parts of the public sector. The productivity within healthcare is 10% higher than the average in the rest of Sweden. The educational level within healthcare is 40% higher than the national average. At Halmstad University, qualified research is being conducted within, for example, AI and health innovation. Region Halland delivers well-executed care and invests a great deal in areas like health, health technology, and welfare. With the framework of Leap for Life, Halmstad University's ambition is to become a top performer in research, education, and value creation in information-driven care. We believe that key factors for success is by a multidisciplinary approach, in close collaboration within the university, Region Halland, international academics, healthcare providers, and industrial partners. We have many research and collaboration activities that is running right now with many different partners. In the academic sector, we have collaboration with Swedish and international universities. In the public sector, we have collaboration with Region Halland and the municipalities in Halland, but also other regions and healthcare organizations in Sweden and in other countries in Europe. In the business sector, we collaborate with companies with big pharma, medtech, healthcare providers, and others. And we also have partnership with AI Sweden and Swedish Association of Local Authorities and Region, SKR. So, to become a pioneer in healthcare, we need to work on several tracks in parallel. We need to build a national spread and acceptance, and that's extremely important for us in Halland, since we are a quite small region. We need to build strong fundamental research, strong research together with industry. We need an effective innovation support system, and we also need to work closely with competence development and implementation, and also build a strong international network and commissioned research. Currently, we have activities of different sorts in each of these parallel tracks, together with partners that I listed in the previous section.
So, what happens in Halland? We doesn't want it to stay in Halland, Magnus. We want to share, we want to collaborate, and we want to work together with others we need help. We need help in the municipalities, in the regions. We need help from the business and universities to solve our problems. I think we need a new way of working in healthcare. I think today we work in a traditional way. We work from the inside to the outside. We work in silos, as you heard before, and we professionals, we think, we plan, we act, and we follow up. Very traditional, I think. And I think we need to work from the outside to the inside instead. So I want to work with you. All this statistics that we collect in from our systems, what does this statistic tells us? For example, we don't use cost per patient inhabitant in the municipalities, but they do in the regions. I think it's strange. We have the same patient. So why don't we share this statistic? And I think we need to be more data strategic planning. Use the facts before decisions. I think today we use for decision what we think and what we plan and what we follow up, but we don't use the statistic as we can. I think also the inhabitants want to own their own information. Now we can share so they can help us between hospital, health center and municipalities. But we don't do that. We own their information, the inhabitants' information, and they have other expectations from us. I think we need to be brave. It's a new way to working, so we need to be brave in our organizations. We need to be innovative. I think we need to talk to each other and talk with each other to find new solutions. Now you have to help me. Is it that way? So sorry. I think when we meet the inhabitants, when we are professionals, they tell us, help us to see our own information. Why do you work in this way? I think you can work better in your process. And we listen, but we doesn't really get it to work. We need to work together about this. So we need to use this digital health care. I think the products in some way are out there, but we doesn't use it as good as we can. So I think we can do better than we do today. We need these solutions and tools. You heard before in the morning, costs for healthcare and social care is increasing. And I think when that happens, we defend our own organizations. We in the municipalities, we defend our organization, the regions, you in the university are in the same problem, and the business, they knock on our door and tell us, we have the solutions, why don't you use us? So we needed to open up and collaborate more together. Another challenge here in Sweden and international is we are a lack of staff. The challenge is that in 10 years, about 60% of all recruitment in municipalities is in. We need to employ it into the health and social care in the municipalities, 60%. We don't have these people out there. We need other solutions, and we need to work together to find these solutions. So we need to work together with business, university, region, municipality, and inhabitants. So we need other ways to do it. And I think we have, as you told before, 10 years of Health Technology Center here in Halmstad. So we have years of innovation experience. But I think we have stopped by doing it very small. I think we need to open up and do it more together. So I hope very much for the Leap for Life, and I hope you will enjoy us. This center, Innovation Center, we hope that you out there and in here, you want to be pioneers in this Innovation Center, work together with us, test new products, test new models, methods together with us. We need that. And we are a collaborative effort. We work, there is municipalities, we have both health and social care, but it's one person we take care about. And the region take care of the same person. So we need to work together. I jump over this picture and I look at this lady instead. She's lovely, I think. She is trying new products, and I see her enjoy in this picture. And others out there think, why can't we? Why don't you have these products in the municipalities all over Sweden? Because I don't have a real answer, but I think we are a little bit too slow. We haven't worked together with others. So I think we need to do it more together. So the mission is, we want to change healthcare for everyone, everywhere, not just in Halland. And yes, I will stop there and say, join our Leap for Life, Magnus. Do you want to say something more about this?
Well, this is has been a really long journey to get to this point where we have such a close collaboration between all the public sectors, the academia, and the industry. And I guess this is visualized through this conference today in a very good way.
Has it been easy, do you think?
It has been a lot of challenges during this time, but with the really clever people, everything works.
I think we have, together we have found our mission together. Because in the beginning, I looked at you and said, what are you saying to me?
Yeah.
I have my own problem. Take care of yours. And you looked at me and told me, oh, you have to do this and this.
Yeah.
So I think now we are together much more, and we have the solutions together.
It's really fun to work like this.
It's really, really fun to work together.